May palagi mo. 4, 6, 8. Yan. 27. Karon pa po ibalik ang kuryente diri man. Nasi ko ganinang odto kay last power na sa kong laptop. Train sa kong laptop. Tulpod ni.
Gusto mo, ino-offer na ni TikTok na buy one take one para hindi ka naman dalawang isip na bilhin mo. Ang lapit talaga ng matitipid mo dito tapos free shipping pa kaya mag-order ka mo. O buy one take one na to ha? Buy one take one.
Let's wait until like 3 minutes. Masulod ang upan.
Take one na baka
Ngayon lang na ulan no. Kusog ang ulan ganina. Sulat na kadali ha. Makasulod ang upan.
Pabilihin. Lahat ng gusto mo, ino-offer na ni TikTok na buy one take one para hindi ka naman dalawang isip na bilhin mo.
Matagitan di. Matagitan.
These past few days, my health is not okay.
Gusto ba mo sagit ka?
Kuhaan pa ko gabi kay pag BP sa... Lain man gito akong ulo bala sakit kayo. Scared ba ko na magsakit akong ulo. Kaya nagsulod sa kong utok mga possibilities. Pag BP ka lang digital good na ano. Digital na
Yes, alam ko. Yellow. K4 power.
ang BP pa.
3 days ko
171.10. Pag pinakmadlo ka, pamanual na ko sa kong anak kasi manual kong BP hindi yun na mao maglog sa dana BP kay 120/8. Lord, hallelujah. May ICU na ko gabi. Pero hindi nakalentura mo ko guys. Hindi na gani dito. Nag-RD man ang mga pambuntag. Hindi naman maski kalentura ko sa RD hindi man ko maghago. Lingkod na magko. So great. Nakurog gani ko ganina. Hapon, nag-RD mangyapon ito kahapon. Hindi akong suka kahapon ito. Maluya manggugpog nara ko dali sa balet. Parang man akong paminaw pag nagsikas. Kaya lang ng mga nakaraang gabi, hindi tayo nagkaklase. Pag inganing orasa kayo nagka-chills. Tugnaw na sakit ini. Uy, sama mo yung mga anak lorot na. Ito mo makakita sa mga binuhi din sa mukan. Ah, ano pa yun? Oh, okay, yun na niyo oh. Mga monster. Baligya. Baligya na lang ni oy. Amo kay, mukan kaya. Kung pre isa kay na. No, 1, 2, 3. Yung kita isa smell kay. 4. Makukulit. Sa mukha ko sa siya po. Wala naman siguro yung masulod aning klasihan eh. Siya naman. 15. Anyway, this is more than half of the class. Wala sila. Okay, so good evening everybody. So tonight we are going to start our new module, which is module 5. So module 5 is about first aid. Okay, so in this module you're going to learn the different emergency situations and how to respond to them. So the skills that you'll be learning in this module is your CPR, your artificial respiration, how are you going to dress a wound, how are you going to bandage. So that will be our lesson for this module. Our lessons will all be about emergency care, like what are wounds, what is hemorrhage, what is syncope, ay makuyapan sa atong himuon. Kaya as healthcare workers, taas ang expectation sa tao sa ato. Nakabalo kita mo respond pag na mga emergency situations. So that will be your lesson for this module. So let me share the PowerPoint for tonight. Do you see the PowerPoint, guys? Raise your cameras, please. Attendance ako. Baluran. Open yung camera. Four, 8, 12, 13, 14, 15. Okay. So to continue. So to start off our new module, so let us talk about and try to understand what is first aid. So when we talk about first aid, so first aid, so from the word itself, first, hindi siya second, hindi siya third, hindi siya last, first. So when we say first, so first aid, so it refers to the immediate assistance that we give to any person. So the word immediate. How do you understand the word immediate? So walay langan, diha dayon. Okay, so immediately. Okay, diha dayon. Okay, so immediate assistance given to any person suffering from either a minor or serious illness or injury. So whether the injury is minor or serious, so we give the same amount of care to give that certain person to make sure that they are attended to immediately. So bisan paggamay sa madlang na kumpara sa uban na mga samar, mga injury na itong nakitaan, dili ta mag-ingon na asos tagamay ra ng samara nya na lang taud sa kinapa ko ginahimo, dili na siya mao. Ngayon tag first aid, so whether the injury is minor or serious, so we attend to it immediately. Okay, so the aim of this first aid, why we attend immediately, is to preserve life, to prevent the condition from worsening, or to promote recovery. So this leads us to the goals of first aid. So the very reason why we perform first aid is for the following: to preserve life, to prevent the condition from worsening, and to promote recovery. So we will further discuss that one in our following slides. So let us move to the next slide. So it includes, so this refers to first aid. So first aid includes initial intervention in a serious condition prior to professional medical help is being available. No? So when we talk about first aid, so this is the first and immediate assistance that we give before an ambulance arrives or before the patient is being brought to the hospital. So just like when somebody get wounded inside the house, no, so pinay masamad sa balay, no, di ba, kung sa itong immediate na ginahimo, ugasan nato, utangan nato betadine, tabunan nato pan-aid. So muna siya first aid. Tsaka nato dalaon sa hospital, no, kung tanaw nato, kinahanglan yun siyang matahi or kinahanglan siyang no, ma-injikan o tetanus toxoid or unsaman. Okay? So, katong mong actions, washing the wound, putting on betadine or covering it with a band-aid, so that is considered as your first aid measures. Okay? So, first aid no, is done no, just like when we perform cardiopulmonary resuscitation. So, I know that you have heard of this already. No? Kanang ginatawag na itong CPR. No? So, CPR or cardiopulmonary resuscitation no, is a procedure included in the first aid measures that we perform when somebody is seriously injured. No? So, ang classification ng pag-perform ng CPR, ito yung ginagawa natin no, pag may isang person no, na nalagay sa serious na no, kalagayan. Serious as no pulse, no breathing ang pasyente. Okay? So, this is the immediate care that we give. So, it is vital for a nursing attendant to know how to perform CPR. Okay? So, whether you are competent, no, kung ang pananaw ni mo sa mga sarili, kaya ni mo dili, you have to push yourself to learn the skill no, and to master the skill and be confident in performing the skill. Because whether you like it or not, the life of your patient is under no, your liability. Whatever happens to your patient, no, ikaw ang una na mohatag o measure no, para ma-save nimo ang kinabuhi sa imuhang pasyente. Ma'am, kami din mag-CPR sa hospital? Yes, there is a great possibility. No? So there is a nurse no, na atay team. No? But say for example, na mga instances guys, no, na duha ka pasyente nagdungan og arrest, tulo ka pasyente nagdungan og arrest. Okay? So kung ang isa ni kabayo na dito speakas, ang nurse tuwa na dito nag-CPR sa ikaduhang pasyente, katong isa ka nurse sa pika station nag-start na og CPR. So ang naman ug ato lang tan-awon na pasyente. So ikaw na nursing attendant, you have to be ready no, to perform no, the first aid measure. Okay? So, unsa may requirement para maka-perform tag CPR, you have to be trained. Okay? You have to be trained. So, that is why, pag puhon, manarbaho na mo sa hospital, no? Every year, nag-renew mo sa inyong BLS certificate. Unsa man ang BLS, Basic Life Support Certificate. Unsa man ang Basic Life Support, your skill in CPR. Every year na siya. No? Every year na siya gina-renew. No? Walay NA, walay nurse, walay mga line personnel sa nursing service, dili kabalo mo CPR. No? Requirement ko na sa hospital. Tanan mo undergo training. No? Ug ang tanan, dapat kabalo. No? So, kani, first hand training ninyo ni. The next time when you finish your training here in White Lamp, then you go to a third-party organization like the CDRRMO or the Red Cross to get your certificate. So that when you apply in the hospital, you already have your BLS certificate to present. Kana timanin ninyo na ha. So puhon, no, kung magtrabaho naman sa hospital, manarbaho mo sa hospital. Yung eskwela gud mo nursing attendant healthcare. No, so manarbaho naman sa hospital, requirement gina siya. No, na namoy certificate sa BLS o ACLS. So ACLS is advanced, no? Advanced cardiopulmonary life support training na siya. So that is it is a different approach to giving first aid. The availability of the medical personnel inside the hospital. So kana training pud mo ana aside sa BLS, mag ACLS pud mo sa hospital. Requirement gina siya sa tanan as nursing service. Okay? So first aid is generally performed by someone with basic medical training. So it does not require to be a licensed health professional. You don't have to be a registered nurse. You don't have to be a physician, for you to give first aid. So anybody can perform first aid so long as you are trained. Mura na requirement, trained ka o certified ka. Okay, you will be saving lives. So when you perform your CPR, you have to be confident that you can really help your patient. Dili pwede buang-buang. Kinahanglan confident ka ba ka nang katabang ka na pasyente ya. Mapaginhawag hindi mo na siya gusto. Mapabalik nimo ang pulso niya. That's the aim of your CPR procedures. Okay? So that's why kinahanglan gyud nakabalo ang NA. Kana magbantay pud tag pasyente sa balay. Ang pasyente na nas balay pinaatiman. Kana mga naga-private duty. Pathanas yung CPR. Whatever happens to the patient in the house, din una mag-start maghatag og first aid measures sa inyong pasyente. Sabtan. Okay. So let's go to the goals of first aid. So the key aim of first aid can be summarized in the acronym of the 3 P's. So I already mentioned this one in the first part of the slide. So the goals of first aid, we have promote recovery, preventing the situation to get worse, and lastly to preserve life. Okay, so it's summarized as 3 P's for you to easily recall. So the first P is to promote recovery. So first aid done correctly should help reduce the patient's level of pain and calm them down during the evaluation and treatment process. So first aid also involve trying makita niyo sa PPT guys. Goals of first aid. Sige na inyong signal. Same tag makita. Goals of first aid. Sige makita niyo na slide. Sige na inyong signal. Goals of first aid. Grace, ano makita niyo mo, Grace?
Introduction lang, ma'am. First slide.
Ay? Wala. Kasi makita ninyo. Kasi makita, Grace.
Goals of first aid, ma'am.
So again, to promote recovery. So when you say recovery, this is bringing back your patient to a healthy status. So to recover. When we say to recover, so ibalik na to ang pasyente sa healthy na nakahintang. So first aid done correctly should help reduce a patient's level of pain, calm them down during the treatment process, or first aid also involve trying to start the recovery. Some cases it might involve completing a treatment, such as the case of applying a plaster or to a small wound. So for example, nice naman. So wash the wound, nice naman, wash the wound, betadine or agua, kuman, utangan din natin. So We are promoting recovery already. No, nga mabalik no, magpadayon no, ang iyahang samad sa pagdugo. Okay? So, next, goal of first aid. Second goal of first aid is to prevent further harm. So, when you say prevent further harm, hindi kaya nato na magdungag tag-injury sa atong pasyente. No? So, the very purpose why we perform first aid is to what? Not to add up pain, not to add up or to make the situation worse. Okay? So, prevention of further harm includes addressing both external factors such as moving a patient away from any cause of harm and applying first aid techniques to prevent worsening of the condition. So, such as applying pressure to stop a bleeding, no? So that the bleed will not become dangerous or life-threatening. No? So, if for example, samad, ako kayo ang samad, perting dugo. No? So, ato ang butangan dili tourniquet. Tourniquet. So, it's like a rubber material that we place to stop no, the bleeding. So we put the tourniquet here so para ma-hold na to ang blood vessel no? Keep it close so para dili magsige og dugo. Okay? So that is preventing further harm no? When there is wound and it's bleeding, so mo gini immediate na to na intervention to apply pressure to stop the bleeding. Kasi diba if we allow bleeding to continue, what will happen? The person might die. No? So, lalo na pag profuse ang bleeding. When you say profuse, so kayo ang gawa sa dugo. No? Sa lawa sa tao. No? Your body cannot tolerate that because you know very well, your blood carries everything. No? Your blood carries oxygen. Your blood carries nutrients. So, once blood goes out of your body, so it's depriving your cells of the oxygen. Udang, di ba, pang tao kung maglabing dugo, duspad, gidayon. Puti, gidayon. Nagom, gidayon. No? Kaya ang oxygen supply mo diminish man po, iniuban man dito sa dugo ang atong oxygen. No? So, once na ay samad, gadugo. So, atong immediate action good is to stop the bleeding. So, we may use a cloth, a clean cloth, no, to cover the wound and to gently apply pressure no, until medical help arrives. No, until madala na tong pasyente sa hospital. Okay? So next and the last P of the goals of first aid is preserving life. Okay? So as healthcare workers, no, so we are said to be advocates of life. When you say advocate of life, that's the purpose of patients coming in and out. So, when we give first aid, ang isa sa ato ang mga ibutang sa panguna-una, no, ang ato ang tumong is dili mamatay ang pasyente. Muna mo si ay ito dayon, no, tahalanon. Okay? Tabunan dayon samad. No, katong grabe dugo. Okay? So to preserve life, isa man naka-goal gyud nato, no, in patient care, preserving life. No, we are not employed by the hospital to kill our patients. We are not there to worsen their condition. We are there to alleviate their pain. You say alleviate? Mapagaan na to ilahang sakit na ginabati. Kaduha, para malamtod pa ilang kinabuhi. No? We are not gods, I know that. No, dili man ta Ginoo, di man nato hawak ang kinabuhi sa mga pasyente. But of course, we have to exhaust everything that we can do for our patients. No? To give them, to lengthen their life somehow. Okay? So we are not there to kill them. We are there to give everything, no? So that they can enjoy and they can live, no, life fully. Okay? So those are the 3 goals of first aid. So as a review, to promote recovery, to prevent further harm, and to preserve life. Okay? So it is important to note that first aid is not medical treatment. So dili na nato ikumpara, no, ang atong mga first aid measures sa kung unsa ang mahimo sa sulod sa hospital. Isa sulod sa hospital, hay man ang kahimo. kompleto ang gamit, kompleto ang mga medical professionals, no? Whereas dito sa community, kung asa ta mag-render of first aid, no, we will make use of what is available. We will make use of the resources that is available. No? Walay gloves, gamit ang silupin para maprotektahan atong kamot. Okay? So first aid involves making common sense decisions in the best interest of the injured person. No? So dapat critical thinking. Alam natin kung ano ang ating ginagawa. Okay? So let's move on to the characteristic of good first aider. So how many of you here are active during their high say mga first aiders sa high school or sa inyong elementary? Tinumdum pa ba mo? Na nag-training mo ani? What are the characteristics of a good first aider? So, na siya requirement guys. So, number 1, first aider should be gentle. No, dili bugat ug kamot. Okay? So, first aider should not cause or inflict pain as much as possible. No? So, dili dapat bugat ug kamot, gentle hands always. No? So, when you touch your patient, make sure you do not inflict pain. No, you have to be very gentle. Okay, when you handle their arm, when you handle the leg, when you touch your patient, your hands should be gentle. Dili bugat. Next is a good first aider, resourceful. So when you say resourceful, how do you understand the word resourceful? Kabalo makita pamaagi or paagi, no? So say for example, mo kay makita na ani na gamit. Kabalo ka unsa imong i-replace? Make the best use of things at hand. Kung unsay naa, no? Kung unsay naa, kabalo ta kung unsa ato no? Ato pwede gamiton. Okay? Next is a good first aider should be observant. What do you mean by being observant? Guys ha, ako'y magre-report. So, when you say observant, no, ang atong mga mata, kabalo, maniid, ug insakto. No? So, we should be capable of noticing every single sign there is. No? We should be always aware of what is happening and we can anticipate, no, what may happen. Next is being tactful. So, when you say tactful, so when you handle the victim, it should be with utmost care and in a calm manner. So, dapat kita, when you say tactful, we have to be watchful over whatever comes out of our mouth. So, when you are faced with an emergency case, so it's very important to be calm. Kita mismo, kalmado ta. Dili kayo mataranta. Malati, unsa man kati, mag-add ka o anxiety sa imong pasyente. No? So, we have to be tactful. No? When we handle our victim or any person needing our care, no? So it should be done in a calm manner. Okay? So, do not make things worse emotionally. Next is emphatic. When you say emphatic, no, you know how to be merciful. You know how to put yourself in place of whatever is the situation of your patient. Lastly, respectable. When you say respectable, hindi respectful ha, respectable. No? So, always maintain a professional and caring attitude. Okay? How do you understand, no, the professional attitude, caring attitude? No? So, when you present yourself, no, when people see you, no, people will beget respect upon how you present yourself. No? Kaya naman ka-respeto ka, no, as a first aider, no, because you need to be respectable so that you can what? Instill confidence to your victims or to the people that you're going to save that you can really save them. Kana ba mo yung kag, ma'am, good morning, ako day si Kathy, trained first aider ko, pwede ko mutabang, no? So kay, dili nang, so unsa man iti, wala, unsa man na, kada kadako ba nang samaran na, kung basi mamatay ka anak te, no? Dili ing anak, no? Kinahanglan, no? Professional manner, no? You know how to present yourself, no? In a crowd, no? That they will be confident that you can really help them, okay? So those are the characteristics of a good first aider. So moving on. So how do we set priorities? So when we are faced with several victims in a situation where there are several victims, so it is very important to know how to set priorities. No, kabalot ta kinsa atong pasyente unahon, no? Kinsa atong pasyente na ato ang unya na lang nato atimanon kinaapat kay mas importanteng pasyente, no, na nasa bingit ng kamatayan, no? So dapat kabalot mo prioritize. Okay? So number 1, no, is catastrophic bleeding. So when somebody is bleeding out, you know very well that what comes next to bleeding is shock. No? The body will shut down automatically. In seconds, the patient can die. No? So when somebody is bleeding, attend to that person or patient immediately. Okay? Any forms of bleeding, no? Any forms of bleeding, masamad man na siya, gumaunsa man na siya ng bleeding, priority gina siya. Okay? Next is airway. So clearing of airway when somebody is blocking the airway. So that is very important also because once the airway is blocked, how can oxygen get inside? Okay? So that can also impede, no, respiration, and thus in seconds the patient can die also. Okay? Next is breathing problems, ensuring respiration. So you make sure, no, when somebody is having difficulty of breathing, naglisod o ginhawa, no, you have to be vigilant already, no, to prioritize that patient. Because you know very well that oxygen is very vital to our survival. Okay? Next is circulation. When you say circulation, when there is no pulse, how do you know that blood is still circulating properly? So that is checking the pulse of your patient. Also, when there is pulse, it means that blood is still circulating and your heart is still beating properly. But when there's no pulse already, then, no, death is imminent already. No? Attend to that patient immediately. Next, when there is a disability. Disability referring to neurological conditions. When you say neurological conditions, this refers to stroke. No, mga stroke attacks, guys. May it be diabetic stroke, may it be cerebrovascular stroke. So there are many forms of stroke, guys. So it's very important to know. So this is also one of our lessons. Ang isa ka nursing attendant, dapat kabalo unsay mga sinyalis. Nakaning pasyentihan ni padulong ning mag cardiac arrest or padulong ni siya mag stroke. Dapat sinyalis pala kabalo na mo. So that you can immediately start your first aid measures. Next is environment. So when you say environment, so say for example, earthquakes, okay, electrocution, na kurintihan, no? So it's also a priority, no? Because it will what? Have an impact, no, on the health and property and life of the people in this particular vicinity. Okay, so those are the things that needs priority setting, no, when there are, no, life-threatening conditions. So the Zoom is prompting already to end. So we have only 1 minute left. So you just wait. I will just send a new link for our our new link for our continuation. Ako na ni-end, guys. 1 minute, mapalo naman po. Okay, wala naman siguro yung masulod. Hindi na para makapanyapo na ta. Ano man to? Wait lang. Okay, let's move on to our next slide for our lesson tonight. So we go now to the different types of first aid training. So for healthcare workers who work in the hospital, so what is required of us is BLS, yung sabi ko ni kanina, no? BLS, Basic Life Support Training, and ACLS. So for other industries, they also undergo a different type of first aid training. Depende kung unsaan gina-require, no, sa ilang community na gina-serbisyohan. So number 1 is aquatic or marine first aid. So aquatic and marine first aid is usually practiced by professionals such as lifeguards, professional mariners, and diver rescues. So this kind of training covers specific problems and first aid measures that may be faced after water-based rescue or delayed medical evacuation is done. No? So from the word itself, aquatic or marine. No? So while personnels, well, there are people on board of a certain ship, no? Para ng mga seaman, no? So they should undergo this kind of training, no? Because we know very well that when as loud, no, wala gi hospital dito. So muna siya na kinahanglan, no, sa isa ka ship, no, sa cruise man na, no, naagyoy nurse or doctor, no, or mismong mga personnels are trained in aquatic or marine first aid, no? So there are a lot of emergency situations that may arise, no? Naa sila sa lawod, no? So kinahanglan kabalo, no, mo attend ang mga tanan, no, kung sa mga posibleng mahitabo sa may common lumos, no, or sa man, no, mabagok, samad, no. So those are a lot of possibilities that can happen on a ship. Okay? So that is why, no, na kanang natay ginapinasahi na training ani, no. So kadungog na ba mo og kanang mga seafarers na nursing aid, nursing attendant, kadungog na ba mo na naay ana sa cruise ship, dagko kay sweldo, no, sa cruise ship, no, kanang cruise ship ilam sa mo sa cruise ship, no, kanang biyahe good na for entertainment, no, na kanang ship na daghan na ay party, no, na ay restaurant, it's sort of like a hotel, no, that they stay there and then they travel to certain areas and then for several days, and so nag-hire na sila. Okay, na ako estudyante sa una. Kuan to siya. Siya sa St. Mary's. Unya. Na, kadungog siya. Ano, nag-eskwela siya healthcare. White lang. Okay. Na siya friend na nagtrabaho sa cruise ship. Good pay. Pero, kanalagi, mag-require yun og marine first aid. Kinahanglan na certificate. Such as that. So next type of training is your battlefield first aid. So this takes into account the specific needs of treating wounded combatants and non-combatants during armed conflict. So I know that you're aware, no, na kaning mga uniformed personnel nato, no, such as kaniadto ang mga armed forces, no, mga army nato. No, so when they go to a certain battle, lagi na sila kauban na medic. No? So the medic is a trained, no, healthcare worker, no, that is trained in battlefield first aid, no? Because iba ang mga wound sa battlefield is iba din, no? So ay pwede mabutan og mga landmines, mabutan og mga missiles, no, or guns, no? So lahi ang quality sa wound pagingana, no? Very serious, no? So kinahanglan train, no, ang mga medic, no, to attend to such kind of job, no? So kani well paid po ni guys, no, na trabaho, no, pag maging call this one medic ka, no? But usually ang ilang ginahire ani is mga registered nurse, no? So ang registered nurse or doctor, no, pag mag-medic mi diretso mi official, no, pag musulod mi sa army, no? So diretso mi first lieutenant. So but our function, no, is to be a medic in the field. But ang mga NA, no, naman po yung mga NA na nasa hospital sulod sa kampo, pareha atong last hiring sa 701st Infantry Battalion diya sa Mawag, sa Tumuran good, no, nag-hiring na sila bago lang, daghan kaayo nag-apply, almost 200 niya ilang i-hire kay isa ka buo na-hire, taga-white lang, babae. So ano pa siya, no, ang iyang salary is para itong trabaho regional kay ano man gobyerno man, pero yung trabaho dili sa mga taskira dito rin sila sa hospital, na may hospital sulod sa kampo, dito rin sila magulat kung na yung mga ihatod or na yung mga sakit yung mga sundalo sulod yung trabaho. Next is conflict first aid. So first aid training, no, that is intended for policemen and non-uniform personnel of the PNP, no, when they will control, no, conflicts in the community like mga riot, conflict sa rally, no, conflict sa demolitions, no, so kinahanglan kabalo, no, ang mga usually mag-attend mga policemen man, no, so this is the kind of first aid that they undergo. It focuses on support for stability and recovery of personal, social group or system well-being and to address circumstantial safety needs. So next is hyperbaric first aid. So hyperbaric first aid is a type of first aid training practiced by specifically diving professionals, so divers. So the most common diving in emergency is decompression sickness. Nawawalan sila oxygen supply underwater. So it's very important that the divers or the guide is trained, no, to respond to emergency cases such as that. So that is hyperbaric first aid, no, na training na undergo. Next is oxygen first aid. So oxygen first aid and hyperbaric first aid is somehow related, no, because oxygen first aid is also providing proper respiration, no, and supply of oxygen to the body to casualties who suffer from conditions resulting to hypoxia. So when we say hypoxia, this is a condition when the oxygen in our body is not enough, it is sufficient. Okay, so it is also a standard first aid procedure for underwater diving incidents where gas bubble formation in the tissues is possible. So next is wilderness first aid. So as you can see in the situation in the picture, when you say wilderness, so these are type of first aid training given to mountaineers, no, or mountain guide, no, to give provisions of first aid whenever there are emergency situations, no, during the hike. Okay, di ba sa bukid, no, kung mag-hiking, different possibilities. Poisoning, no, you will be bitten by poisonous and wild animals, no, like snakes or spiders or bees or whatsoever. Pwede po mo fracture, no, kung ma-slide mo sa trail, no, so isod, no, wala may hospital sa bukid, no, nga isod po sa kaon o ambulance, no, kay puro kahoy, di man masakaan o sakyanan, no, so walang kinahanglan ang mga mountaineers o ang mga guide trained yun, no, to give the first aid, no, and then they can bring down the patient, no, to be brought to the hospital afterwards. This is the kind of first aid training that you have to undergo. And lastly, we have mental health per se. From the word itself, mental health. So this is not physical issue, but this is mental issue. So when somebody is mentally ill in the community, so hindi basta-basta mag-pick up ng tao na may mental condition. They are strong, they're violent. So it's very important that there are personnel in the mental institutions, who is going to pick them up, who are really trained, to give first aid measures, when they're going to pick these people up. So it's very important, that communication is a skill required for this. Dili lali magpunit o kana mentally ill. Okay, di ba violent ang uban na sila. Unsa naman niya akong iring? Teka lang ha, muling nahikog. Baliw niya.
Okay, mga
Awa. Hikog, ha? Yan ang pagka-outfits. Iki. Pamatay. So that is your mental health first aid. So written here in our slide. So it's very important that people who work in the mental institution is going to administer first aid measures, knows how to assess the risk for suicide or harm. So delikado ba yan basta na yung mga mental issues, risk for self-injury or injury to others. Then they should be capable of good communication skills, to listen non-judgmentally, give reassurance and information to the patient and the family, and then encourage appropriate professional help and encourage self-help and other strategies. So those are the different kinds of first aid measures. I will cut the lesson at that. After GC. If I am okay already, so I will meet you face to face. But if my condition persists, ano lang sa until I am fully well. Kuya jugo guys, sa tinol lang. Ilang guys halat ta. Okay. Lain man ko, di begi ko maghalat na ako mati. When I say like I'm not okay, then I'm not okay. So you just wait in the GC. Kung sa Sabado, pero magklase ta. Either face to face or start naman sa new module. So you get your modules if ever mag face to face ka. Okay, dito sa module lang atong mga lessons. Bago man to na gi-revise na ako na module. May uban na nagkuha na. So that's all for tonight. Thank you very much for attending your class. Mihapon na mo. Bless everyone. See you on Saturday, whether online or face. God bless everybody.
Right.